Hi, welcome to Open House 2020. My name is Marcy Cameron, and I teach the healthcare class at Saguaro High School for the Scottsdale Unified School District. This is a CTE class. It is a dual enrollment class. It is a block class. It is a lab-based class, and it's a class where at the end of the year, students can get certified for their nursing assistant's license or certificate to begin working in their healthcare careers. A brief overview of what this program is about. It is for students who are interested in a health career, maybe not really sure what they want to do. We are focused a lot on nursing. A lot of the students that do take this class are interested in becoming nurses. And because it is a nursing assistant class as well, we do get a lot of focus there. But we do have many students who want to do medicine, pre-med, who are interested in being physician assistants, nurse practitioners, physical therapists, athletic trainers, therapists, speech and language. The list goes on and on. Even social worker, we've had a few that even decide to go into other areas of healthcare, like working in lab, working in research, working in diagnostics, things like that. So there's a lot of different ways students can utilize this information. This experience is a lot of hands-on. It's great for students who are unsure if they're going to be able to work with patients, because they're going to get a lot of practice working on each other and with patients during our clinical setting. Most of our students at the end of this year feel very comfortable pursuing their next endeavors in their post-secondary, whether it's nursing or medicine. And they usually feel that this class really put them above the rest of their class. I've had students who have gone pre-med and into med school, and they say their first set of rotations, they're very comfortable with patients, and they look around their clinical groups, and most of them are afraid to even touch a patient. And so by having this class, they really feel that it just kind of put them over that hump in working with patients. Nurses, the same thing. Getting into nursing school, there are clinical rotations as well, and having pretty much what block one of a nursing program is, that's what this class is, under their belts. It makes them just feel that much more confident in their programs. It's also a good way to afford college. Students who do need to put themselves through college or have to work through college, this is a great way to get an entry-level position in healthcare while they're going to school. So it is a block class. That means your student is here for 2 class periods. First and second is set for my students that come from other high schools. So we have Chaparral, Desert Mountain, Arcadia, Coronado students in that class. And then third and fourth hour are for the Saguaro students. The block format works very well in this class. We participate half the class generally in didactics or lectures or classwork. And then we do a good portion of each class in our lab. Because of the distance learning this year, lab will look a little bit different. We'll do a little bit at home, and hopefully we'll be able to get an open lab as the year progresses, so we can get some hands-on practice. I'm confident that that will happen. I was able to bring in small groups of students at the end of last year to help prepare for their nursing assistant exam, and that worked just fine. We wore our PPEs, we provided, we understand infection control very well in this class, and we had no issues whatsoever in doing that experience prior to their CNA exam. So the CNA exam, that is something that we do offer at the end of this school year. Students will be qualified to sit for the Arizona Board of Nursing nursing assistant exam. It's a skills test and a written test. There's the oral or the written test is knowledge-based. It's a multiple choice question, and then they'll be given skills in which they will practice and perform for the tester. The testing is done by the state of Arizona. It's not done by the district, but it will provide students who pass with a license or the ability to get a license to be a practicing nursing assistant. And more information on that to come later. Because we do the clinical rotations in second semester, we do have some requirements that as parents, it's a good idea to have them on your radar and to start checking them off your list. That's listed in the syllabus that you were able to access online. But just to reiterate, quickly, your students will need to have a physical similar to what a sports physical is, just to show that they are able to perform the duties that are expected of them. Immunizations need to be up to date. You can check with your school nurse regarding any immunizations or lack of immunizations. We do need flu shots every year. Nursing students will need to get a tuberculosis skin test or a TB skin test. That is something that the school district doesn't require, so we do not have records of any of that for your child. So look through their records, see if they received one in the last year. If not, when they go for that visit, make sure you get a TB skin test done. That is something that our clinical partners do require for students to have. They do need to be CPR and first aid certified. I take care of that in this class. They will also need to have a fingerprint clearance card. The fingerprint clearance card is done through Arizona Department of Public Safety. It is good for 7 years. It does cost $65, and unfortunately that's a little pricey for some of the students, but it is something that they'll have for the next 7 years. If they work in any healthcare setting or in any school setting, that is a requirement of employment. So they will utilize it. It's also a requirement for clinicals. If they go on into nursing or med school, they'll have to have that as well for here, the state of Arizona. The class fee is $100. That class fee will cover urine drug screen testing, which is something we do prior to clinicals, self-explanatory. We also will do CPR and first aid certification out of that. They'll get scrubs and a stethoscope, and then any other incidentals that we may have to encounter in order for clinicals to happen. That's what our class fee is for. It is a dual enrollment class. We are dual enrollment through Scottsdale Community College. It is 6 credits possible, 3 credits for medical terminology, 3 credits for fundamentals and healthcare basics. That is done during the 2nd semester, and I will send information out as we get closer to that. Generally, we do start talking about it in December, and sign up is generally around January. We do HSOSA is it's our organization for students, so it's part of our program here. We do our HSOSA meetings in class. It's a student organization for high schoolers and college students who are interested in a career in healthcare. It is primarily, it's a community service, but it provides a lot of leadership opportunities. Usually with HSOSA, we do several field trips and conferences. I am not sure if we'll be able to do any of those or if they're even going to be held this year, but I will keep you posted on anything HSOSA related as the year progresses. And like I said, it's a block class, so your students are here for the 2 class periods. That affords us time to have some lecture and some class experience, and then do some laboratory work as well. This class is very close-knit. By the end of the year, they all know each other very well, and look up to each other and utilize each other as support systems and contacts throughout the rest of their probably school careers. We generally stay in touch with each other following this class. I frequently will will assist with writing resumes. I'll write letters of recommendation and also help them start their networking file in their professional careers. So it is a good lead or a good way to start that post-secondary education by having this under your belt. Students, can get entry-level jobs following this. They can work as a patient care tech or as a nursing assistant. Some choose to go into medical assisting. Others will go into scribing or some of the other non-patient care aspects of healthcare, working in the business offices, dietary nutrition, that sort of thing. But it does give them an introduction to healthcare and hopefully helps them decide which area they want to go into and where they want to focus their college classes at. I have a syllabus as well as a policy handbook online for you to look at and peruse. We do follow Arizona State Board of Nursing regarding certification and regarding nursing assistant programs. So many of the rules and regs that I have in this class are all because of what we have to do for the Board of Nursing. Attendance is mandatory for this class, no more than 10 absences per semester. So that means in our distance learning, students do need to show up on time, ready to learn for each class session that we have. And we will conduct our Zoom classes just like we would conduct an in-class one, as close as we can to that. Oh, let's see. I think that's probably a lot of information in a short amount of time. Just know that I will have office hours throughout the week by appointment only. We can utilize our Zoom chat for that. I'm using just one Zoom meeting site, so kids can pop in and out of it to talk with me anytime during that, during my office hours. I do want it by appointment only, so if it's something private, I only have only one student on at a time. And this is a good time as family members for you to get on as well to discuss anything that you need to discuss with me. Anytime that you do need to talk, students will have my information, my telephone number, and we text back and forth quite a bit. They can just text me when they need to meet, and we can meet on Zoom. Zoom does record everything that we're doing, so those eventually, you know, we will have access to that, and so you'll be able to pop in, and students will be able to look at some of the recordings of anything that they may have done or that I posted for them. I think that's about all I can think of at this point. Don't hesitate to ask questions and contact me for anything else. I'm always reachable by email, and again, text messaging is just fine with me. Want to welcome you to Saguaro, and those that are distance learning for the first time. It's okay, we're going to get through this, and I think your student will be successful.